Okay, here's a sample. As we said, maintaining client safety is also a nursing priority. So when no physiological needs exist, safety needs to receive priority. Safety questions are questions that focus on maintaining a safe and secure environment for the client and the nurse. Because client and environmental safety is a nursing priority, always carefully consider any option that ensures the client's safe care. Let's take a look at a safety question that would require us to eliminate distractors and choose the correct response. First, let's separate the case scenario from the stem of the question. To do so, we will need to restate the question in our own words because the case scenario and the stem seem to run together. The case scenario tells us that the nurse is managing care for a group of clients. The stem of the question asks us, in which statement is it proper for the nurse to have suspended a client's right? Let's identify the critical elements. The key word is proper. The client is the client. The issue is client rights, and the type of stem is a true response stem. Now we can start to look at and eliminate distractors. Number 1, an elderly female is to be evaluated for placement in an extended care facility, and her records are released to the facility's reviewer without obtaining her consent. We can assign a minus sign to this choice. HIPAA laws regarding the release of a client's personal medical information are very clear. Records cannot be released except in a very few exceptional circumstances without first obtaining the consent of the client. Do not assume that because the client is elderly and being considered for placement in an extended care facility, or ECF, that the client is unable to make this decision for herself. She may simply be going to the ECF for further rehabilitation following a stroke, fall, or joint replacement and have complete legal and mental competence. Option 2. A male schizophrenic client is placed in the seclusion room of the psychiatric unit for making frequent outbursts of obscenities directed at female nurses. We can assign a minus sign to this choice. Laws regarding the seclusion of psychiatric clients are very clear. Unless the client is of danger to himself or others, secluding the client improperly for the convenience of or comfort of the nursing staff might be considered false imprisonment. Option number 3. A confused female client recovering from a head injury and abdominal trauma has her hands placed in mitts to prevent from dislodging her nasogastric tube. We will assign a plus to this option. We know that confused clients may be at risk for self-harm, and that this risk is one of the few reasons that restraint is allowed under current JCAHO guidelines. If the client dislodged her NG tube, she could be at risk for aspiration of stomach contents. Therefore, since mitts are the least restrictive device available for hand restraint, this is likely to be the current and correct answer. Option 4. An 18-year-old male client admitted following a drive-by gunshot wound to the abdomen has his visitors limited to family only on the request of his parents without his input. We will assign a question mark to this option. We know that it is important to keep clients safe, and this looks like an option to do so. However, the client is at 18 years of age, considered an adult, and restrictions of his visitors must be discussed with and approved by him. Do not assume that because the client is a victim of a gunshot wound that he is unable to make his decision for himself. Question states that he has suffered trauma to the torso rather than the head and may have complete legal and mental competence. In this priority question, we now have 2 probably wrong answers, choices 1 and 2, 1 possibly right answer, choice 4, and 1 probably right answer, choice 3. We have noted that all 4 answers are plausible, but we know that there can only be 1 correct choice. Since when we apply Maslow's hierarchy of needs, we see that all represent safety needs. We must now use the legal and ethical guidelines that help us make those choices. Choice 3, restraint to prevent self-harm, is the only option that represents a situation in which it is proper to suspend a client's rights. Now we should go with what we know and select choice 3 as the correct choice. Ready to try one on your own? Okay, here is a sample safety question. I would like you to practice setting priorities and eliminating the options. Once again, before we proceed, we should notice that this question deals with the issues of domestic violence and potential elder abuse, very serious legal issues. To answer this question correctly, we must be familiar with both the legal and ethical guidelines the nurse must use to reply to the client. Let's separate the case scenario from the stem of the question. The case scenario tells us that while assessing an elderly male client, the nurse notes several bruises in various states of healing on the client's torso and thighs. The client reluctantly confides that his son, with whom he resides, occasionally strikes him. The client asks the nurse to maintain this confidence by stating, "My wife is dead, I've sold my home, and I have nowhere else to go." The stem of the question asks the nurse's best response. Let's identify the critical elements. The key words include elderly, various states, and best response. The client is the elderly client with bruises. The issue is the client's son strikes him. The type of stem is a priority response stem. Now let's look at and eliminate distractors. Option 1. Don't you have any friends that you can stay with? We can assign a minus sign to this option. The client has already stated in the case scenario that he has nowhere else to go. This non-therapeutic response is the client appears paternalistic. Option 2. This is a legal issue I will have to report to the proper authorities. We can assign a plus sign to this option. You are correct that HIPAA laws regarding the release of clients' personal medical information are very clear. Records cannot be released except in a few very exceptional circumstances without first obtaining the consent of the client. Domestic abuse of children or the elderly, considered to be populations at risk, must be reported to the appropriate authorities according to the laws of the jurisdiction, which may vary from state to state. Option 3. I will have to discuss my findings with your physician. A question mark can be assigned to this choice. The physician is a healthcare provider involved in the client's care and must be informed to properly treat the client. However, the physician will likely discover the bruises independently, have suspicions about their origin, and also ask questions regarding the client's safety. Regardless, this does not mean that the nurse is not responsible for the information regarding the potential abuse of the client. Option 4. Let's talk about the reasons that your son hits you. We can assign a minus sign to this choice. This non-therapeutic response to the client appears to imply that there would be a reason that the client would be struck in the family home, or that it is the client's fault that he is being struck. It is never appropriate to strike a family member. In this priority question, we now have 2 probably wrong answers, choice 1 and 4, 1 possibly right answer, choice 3, and 1 probably right answer, choice 2. We have noted that 2 of the 4 answers are plausible, but we know that there can only be 1 correct answer. We have applied Maslow's hierarchy of needs and see that both represent safety needs. We must now use the legal and ethical guidelines that help us make those choices. Choice 2, reporting the potential abuse to the authorities, is the only option that keeps the client safe. Now we should go with what we know and select choice 2 as the correct response. Let's look at another nursing principle that we can apply to priority questions.